much. Thank you guys that you're still here, staying on. There is so much information to take in that is helpful to all of us. And not only for you, remember, share on social media with the people that you know. It may not be helpful to you right now, but the next person might use the information. And our next speaker is Sister Hanlie Monnery. She's been with the Medfem Fertility Clinic since 2001 and is responsible for IVF coordination. Hanlie completed her nursing qualifications at Sharley Cribb in PE, in general community, psychiatric, and midwifery. Prior to joining Medfem Fertility Clinic, Hanlie worked in both casualty and maternity ward. And Hanlie is coming to speak about why a fertility coordinator is important in ART.
Yes, my name is Hanlie, and I'm here to talk to you on the role of an IVF nurse coordinator in ART. Why do you use a nurse? So my agenda, I'm going to talk about the roles of an IVF nurse, the definitions, breaking old stereotypes, unique challenges that we face, investigating existing research, and launching new research. So, just thank you everybody for giving nursing field this opportunity. Thank you to Mandy. Yanniku helping me with my, from Time IT, helping me with my presentation. Technology is not my thing. And for the support from my team. So topic 1, definitions of the role of a nurse. So I went to look at the law. Government Gazette 12, May 2020, says scope of nursing, we registered. And see, I knew my eyes are not that good. The Act, as well as regulations, rules and codes made in terms of the Act, provide the legal and ethical framework for the practice of nursing. So if we look, it says nursing is a dynamic process. This is what our law says. I think South African law is quite good. It compares very well with the rest of the world. It says, A, nurse promotes, supports, and restores health status. In fertility, restoring fertility is a bit challenging. So sorry. There we go. It helps. Then B, assists, counsels, and educates a healthcare user to maintain basic activities of health, of daily living. You know, this fertility thing can take over our lives. And just getting somebody helping with the balance of everything is kind of helpful. Requires judgment within a caring therapeutic relationship with the healthcare users, informed by a context in which it is practiced. We work in a specialized multidisciplinary team. This is a few people coming together. Having somebody to guide you through that helps. Then maintains continuity and coordination of the healthcare user. Nurses know the shortcut. If you want an answer quickly from a doctor, ask a nurse. If you need a prescription quickly, we're the go-to people. We can help them. Provides continuous support and care to the healthcare users, irrespective of their state of health and through all stages of health. Looking at onco-fertility people getting that diagnosis, it's important to be able to help and assist with that. Nurse provides and maintains a safe, conducive environment for healthcare. Luckily, fertility is a specialized field, so we're kind of lucky in that it's easy for us to have that conducive environment. Then it allows for the execution of treatment and administration of medication prescribed by authorized registered person. Unfortunately, in fertility treatment, injections, medication, IV therapy, theater, you need your nurse to be skilled so that you feel safe and that you feel cared for in this whole situation. It's important for us to have those skills and have them honed very well. You don't ask a doctor for an injection, you ask your nurse. allows for, prevents illness, injury, and disability, and alleviates pain and suffering. So getting to fertility before you even start with treatment, it's not easy always to have that realization, so I have to go somewhere to achieve the family. We have to be aware of that, and we have to recognize and really coordinate care skillfully. And then the last one, it engages in administration, education, teaching, and research required to implement or complement the nursing practice. This is what I'm going to get to in the end of my talk. I think our law really actually states what I need to talk about. This is basically the roles of a nurse. But I went looking for other definitions, and I found one in England where they spoke of fertility specifically, and they said the provision of fertility services to support those seeking treatment for infertility is a newer area of nursing practice, and the fertility nurse is responsible for providing a holistic approach to investigation. That's what our law said, treatment, and early pregnancy through compassionate, informed, and evidence-based practice. Our law was before England. And it's the first role, engaging with a multi-professional team and lobbying to improve services across the UK. I think it's across the world. More definitions. I know it's late, so I looked for something funny. Gillette Children's Hospital said, okay, so we're leaders and researchers and we're listeners. There's one at the bottom where it says resource. Sometimes you have to MacGyver. Quickly, I remember one situation where, so nobody likes to work when it's hot. Sperm doesn't like to do lots of work when it's hot. And this poor lady's husband was working in mines. Before their fertility treatment, she arranged everything. You know, we like to make plans. He's not going to go under in the mine for the week before he needs to give his sperm sample. And then, of course, something broke in the mine, and 3 days before he needed to give his sperm sample, he needed to go in the mine. So she calls crying, "Sister, help, what am I going to do? This is such an expensive procedure. How am I going to manage this?" So MacGyver, I said, well, let him take an ice pack off and a bit of underwear, and let him just change his underwear a few times while he's down there. So my personal experience of our roles, we have to wear many hats. Some of those hats fit easily, some of them don't. But here we go. Topic 2, breaking old stereotypes. So funny or not, I think traditionally, this one, typically nurses were seen as in the subservient role. We take the orders, we do them, no brains required. Sometimes, sometimes it's that scary nurse in the older hospitals. When you're a patient, you don't want that. And some nurses did it to get up and out and have an easy life. And sadly, also, some nurses, it's a paycheck. I'm not really in there because it's a passion. I'm not really in there. And we need to go through, we need to go and prevent that. So sorry, I can't read, and I didn't put my glasses on. It's not so good for camera. So 1 second, let me just get to that page. And I'll read it from there. So we've all felt them at some point in our lives. Stereotypes grow to become commonly known beliefs about certain social groups or individuals. We must reject not only the stereotypes that others have of us, but also we have of ourselves so that we can grow. And the problem with stereotypes is how it can keep us from becoming a true partner in this multidisciplinary team. So those are just some of the challenges we deal with. Then chapter 3, unique challenges to nursing and art. So infertility patients, getting to us is already painful. they need that support. It's not somebody that, is in a healthy spot. They're already in an unhealthy spot. So we need to offer holistic care to both males and female patients in traditional relationship. We all know about Venus and Mars, different strokes for different oaks, and we need to be aware of that. The fertility field also challenges some potentially conflicting personal beliefs. LGBTQ, we're here, we can help you, but we need to be in a good spot to help everybody and not to cause harm to anybody. Then South African fertility services, I think, is the best in the world. So people come to us for treatment. But as Mandy said, that means that, knowing because of their background, foreign patients may have different expectations coming to South Africa. I once had a patient tell me, so what blood test do you do on your egg donors, sister? And I said, no, we do this, and you don't do the whole genetic profile? My goodness, we need to be aware of that. And also the laws, as Mandy said, that we do a professional service within that situation. Technologies, now we all have talents, not talent of me. Technologies continue to evolve. It's becoming more important in fertility treatment. We need to keep up, but we also need to protect ourselves from burnout in all of this. So we work within a multidisciplinary team, trying to make it a little bit fun. So there's the doctor, embryologists, pharmaceutical companies, the psychologists, support groups, important role they play, and then the nurses. We have to create that culture of care so that everybody can work together. A team is a group of people, not just that work together, but a team is a group of people that really trust one another so that we can have healthier patients. So topic 4, investigating existing research. I'm looking for research that says, what does fertility nurses do? How can we do it better? I didn't find anything. The first one was interesting, a qualitative study on the relationship between doctors and nurses offering primary health care in KwaNobuhle, Uitenhage. I'm from Uitenhage. That's where I grew up. Also, there was this structural and perceived medical dominance, a study to barriers of nursing in the workplace. There were a few, but there's nothing specifically to fertility nursing and how we can do our job better. I also looked at nurses' experience of humor in the clinic setting because, if we're all in a happy space, the patients are hopefully in a happier space. I didn't find anything specific to fertility nursing. So topic 5, that last point on the act that said what our roles are. On the way to super nurses, Walt Disney said the way to get started is to quit talking and begin doing. So I'm proposing starting research involving everybody, involving the fertility specialists, the embryologists, the nurses, pharmaceuticals, egg donors, egg donor agencies, psychologists, support groups, warriors, surrogacy lawyers, and the patient, and doing like short surveys and asking everybody, please help us here, let us become more professional. Just short survey of questions asking, what are your frustrations with nurses at the moment? What are our frustrations within ourselves? What are we doing well? But I don't want to do this alone, so I need everybody's help, please. There's things that I'm really not good in. Technology is one of them. So I need more ideas, and I'm asking people to please help with this so that we can improve our care to the patients. So in summary, nursing and art. I hope I get the last page because eyesight. Thank you. Nursing and art is a relatively new field for which no specific nurse training is yet formalized. This requires us to wade into new waters and discover how best to meaningfully partner within the multidisciplinary team in order to benefit our patients most. It is unique in that our patients require specific support before treatment even starts, requiring improving our skills in counseling and recognizing early to refer patients as needed. Challenges certain religious belief systems, which can lead to personal moral dilemmas. And if we are healthier in ourselves, we can do a better, give a better service. Technological advances could be difficult to master, and in such, it can possibly limit how we best care. Ask me anything technological, I call our IT team help. We must guard against burnout when the need to wear many hats increase. And we increasingly deal with international patients requiring thorough knowledge of relevant laws, not just South Africa, but all the countries that we work with. So I call to all nurses in fertility clinics, to all of the role players, to please help and assist in this research to explore how to improve our services to patients and both the colleagues that we work with. Thank you.